Today I'm going to be explaining how to place an indwelling catheter in a female canine patient. Generally speaking, when placing an indwelling urinary catheter into a canine female patient, you would want your patient to be either sedated or under general anesthetic, as it would be very difficult to place in an awake patient. So I'm going to show you the supplies that will be required for this procedure. We would have sterile gloves. We would have 2 catheter-tipped syringes available for discard and for our actual collection of our sample. We would have 2 syringes of sterile saline, one for cleaning the vaginal vault and one for blowing up the balloon for our female Foley catheter, which we have here. We would have exam gloves ready for cleaning our area prior to catheter placement, our chlorhexidine scrubs, sterile lubricant jelly, clippers, our red top tube for our sample collection, and our vaginal speculum for our speculum procedure. So keeping in mind, there are 2 ways to perform a female canine catheter placement. We can do a blind or tactile method or visual with speculum. What I'm going to be initially demonstrating to you is the blind or tactile method. So what I need to do prior to even placing the catheter is I need to prep my patient for this. Most of the time when we're placing a catheter into a female canine patient, it will be for indwelling purposes for us to be able to monitor urine production. We will, however, sometimes use this method for collection. What I'm going to demonstrate is how we would prepare our patient if it was an indwelling catheter that was staying in for a long period of time. We would be clipping all around our vulva area. So of course this is a model, so I'm not going to actually clip, but we would be clipping all around this area. We would be getting into the folds of the vulva, clearing away any hair that was in our way to keep everything as sterile as possible. We would then take our chlorhexidine gauze with exam gloves on at this point, scrubbing all in around the folds, keeping in mind that our patient would be in dorsal recumbency, recumbency, sternal recumbency, okay, sorry, we got